Imagine you need surgery, but there's no anesthesia, no painkillers, no way to make you unconscious. You'll be awake. You'll feel everything. Every cut, every probe, every saw through bone. And your surgeon's greatest skill? Speed. Because the faster they operate, the more likely you are to survive the shock of unbearable pain. This wasn't the Dark Ages. This was medicine just 180 years ago. Before 1846, every surgery was a race against agony, and patients faced a choice: suffer the disease or survive the cure. Today, we're going back to a time when the operating room was a chamber of horrors, and the bravest people alive were those who walked in voluntarily. This is the brutal reality of surgery before anesthesia. Before 1846, surgery sounds filled hospitals with screams. Constant, blood-curdling screaming. It was so normal that medical students were trained to work through it. The sound of agony was just the background noise of healing. Surgical theaters, yes, they were called theaters, were amphitheater-style rooms where students and physicians would gather to watch operations. Picture this: you're strapped to a table in the center, surrounded by dozens of observers taking notes while you scream in agony. Most hospitals scheduled surgeries early in the morning. Why? So other patients wouldn't have to listen to the screams all day. The psychological trauma of hearing surgery was considered almost as bad as the surgery itself. Robert Liston, one of the most famous surgeons of the 1800s, was called the fastest knife in the West End. He could amputate a leg in under 2.5 minutes. That was considered spectacular. It was life-saving. In fact, Liston was so fast that he once accidentally amputated his assistant's fingers along with the patient's leg. Both men died of infection. A watching spectator died of fright from watching the blood spray. It's the only surgery in history with a 300% mortality rate. But his speed also saved countless lives, because in the race between the surgeon's knife and the patient's capacity for shock, every second counted. So what did doctors use before anesthesia? The honest answer? Not much that worked. Alcohol was the most common option. Patients would be given massive amounts of whiskey, rum, or brandy, enough to cause severe intoxication. The goal wasn't to eliminate pain, but to dull awareness and reduce memory formation. You'd still feel it, but you might not remember all of it. Maybe. The problem: alcohol is a terrible sedative for surgery. It doesn't eliminate pain. It can make patients violent and uncooperative, and it increases bleeding, which is the last thing you want during an operation. Opium was another option. Derived from poppies, opium had been used for pain relief for thousands of years. In liquid form as laudanum or eaten as raw opium, it could provide some pain relief. But here's the catch: the doses needed to truly block surgical pain were often fatal, or would render patients unconscious but unpredictably. Someone might wake up mid-surgery, or they might never wake up at all. There was no standard dosing, no quality control, and no way to ensure safety. Opium also depresses breathing. Combine that with the physical trauma of surgery, and many patients simply stopped breathing on the table. Some surgeons tried other substances: mandrake root, which contains scopolamine and has hallucinogenic and sedative properties; hemp, henbane, various herbal preparations with exotic names like soporific sponges, cloths soaked in opium, mandrake, and other substances, then held over the patient's face. These methods were unreliable at best and dangerous at worst. Most surgeons didn't even bother. They relied on restraints and speed. If you couldn't drug patients into submission, you had to hold them down. And hospitals developed frighteningly effective systems for this. Patients were strapped to specially designed surgical tables with leather restraints. Arms, legs, torso, even head, all secured. Strong assistants, sometimes 4 to 6 of them, would physically hold the patient down. Their job was to keep you immobile no matter how much you struggled. Surgeon Charles Bell wrote in 1808, "It is necessary to keep the patient's body steady, and the assistants must be strong and prepared for violent struggling."
But here's what's truly haunting. Many accounts describe patients begging, pleading to be let up during surgery, promising they would be still if only the cutting would stop. And surgeons had to ignore these pleas. they had to keep cutting. Fanny Burney, a British novelist, underwent a mastectomy without anesthesia in 1811. She wrote about it afterward in a letter that's almost unbearable to read. She describes 7 men holding her down while the surgeon cut. She wrote, "I began a scream that lasted unintermittently during the whole time of the incision, so excruciating was the agony." The surgery lasted 20 minutes. It took her months to write about it. The description is so vivid, so traumatic, that some historians consider it one of the most important documents in medical history. And she was lucky. She survived. She lived another 29 years. But the psychological trauma never fully left her. She could barely speak about it even decades later. This was the reality. No matter how brave you were, no matter how strong your will, the pain was beyond what the human mind was meant to process. Because surgeons couldn't control pain, they controlled time. The faster the operation, the less pain endured, and the less time for shock to kill the patient. Shock, the medical kind, is when your body's response to trauma causes your blood pressure to drop, your organs to fail, and your systems to shut down. Pain causes shock, blood loss causes shock, and shock was the #1 killer in surgery. So surgeons practiced. They developed techniques to amputate limbs in minutes, remove bladder stones in under 60 seconds, and perform other operations at breakneck speed. Amputation was the most common surgery. Battlefield injuries, industrial accidents, and untreatable infections often left amputation as the only option. Here's how it worked. The surgeon would mark the cutting line. Assistants would hold the patient. In one motion, the surgeon would cut through skin and muscle in a circular pattern, like peeling an orange. Then they'd saw through the bone. The entire process, 2 to 3 minutes for a skilled surgeon. There was no time for precision, no time for careful blood vessel sealing. They'd cut, saw, clamp the major arteries with forceps, tie them off with silk thread, and fold the skin flaps over the stump. Done. Next patient. Success rates? Amputation had about a 25 to 40% mortality rate, not from the surgery itself, from infection afterward. But that was considered acceptable because the alternative was certain death from gangrene. Some surgeons became famous for speed. Dominique Jean Leray, Napoleon's chief surgeon, reportedly performed 200 amputations in 24 hours after the Battle of Borodino. That's 1 amputation every 7 minutes, continuously for an entire day. He saved countless lives, not through better technique, but through sheer speed, getting to wounded soldiers before shock and blood loss killed them. Let's talk about what this did to people's minds, both patients and surgeons. For patients, the fear of surgery was often worse than the disease. Many people chose death over the operating table. Infections, tumors, bladder stones, conditions that are routine today, were often fatal because people couldn't face the trauma of surgery without anesthesia. Hospitals would often lose patients the night before surgery. People would literally flee. Can you blame them? But what about the surgeons? Imagine having to hurt people who are begging you to stop, knowing it's the only way to save them. The psychological burden was immense. Many surgeons wrote about the emotional toll. Some turned to alcohol. Others developed what we'd now recognize as PTSD symptoms, nightmares, intrusive thoughts, emotional numbness. John Flint South, a British surgeon, wrote, "The pain that the patient underwent was often greater than the pain of the disease. I have seen the strongest men weep like children." Some surgeons simply couldn't do it. They left surgery for other branches of medicine. Those who stayed had to develop what Victorian doctors called necessary cruelty, the ability to cause suffering for a greater good. Before each surgery, surgeons would prepare themselves mentally. They knew they were about to deliberately cause the worst pain a human could experience. They'd take a moment, steady their hands, and remind themselves, this is mercy, not cruelty. Speed equals survival. Then they'd walk in, and the screaming would begin. On October 16, 1846, something changed forever. At Massachusetts General Hospital in Boston, a dentist named William T.G. Morton demonstrated something that seemed impossible: surgery without pain. The patient, Edward Gilbert Abbott, needed a tumor removed from his neck. Morton administered diethyl ether through an inhaler. Abbott went unconscious. Surgeon John Collins Warren removed the tumor, and then nothing. No screaming, no struggling. Abbott woke up and reported he'd felt no pain. Warren turned to the watching doctors and said 5 words that changed medicine forever. "Gentlemen, this is no humbug." The news spread across the world at lightning speed. Within months, ether was being used in London, Paris, across Europe, and around the globe. It was called a miracle. Some religious leaders called it blasphemy. Wasn't pain in childbirth God's will? But doctors and patients knew the truth. This was liberation. Fanny Burney, who survived her agonizing surgery, heard about anesthesia before she died. One can only imagine what she thought: that her trauma could have been prevented by a discovery made 35 years too late. Suddenly, surgeons could operate slowly, carefully. They could perform complex procedures that had been impossible when speed was the only priority. Mortality rates began to drop. Modern surgery was born. Today, you can undergo surgery and feel nothing. You go to sleep, you wake up, it's over. We don't think about it. We schedule surgeries like appointments. We complain about hospital waiting rooms. But just 6 generations ago, surgery was torture, literally. It required a level of courage we can barely comprehend. Patients walked into those rooms knowing they would experience pain beyond description, and chose it anyway, because the alternative was worse. And surgeons had to become people capable of causing that pain, day after day, knowing it was the only way to save lives. The discovery of anesthesia didn't just make surgery painless, it made modern medicine possible. It allowed the careful, precise operations that save millions of lives every year. It freed both patients and doctors from a nightmare that had lasted for all of human history. So the next time you're given anesthesia, for surgery, for a dental procedure, for anything, take a moment to appreciate it. You're experiencing something that your ancestors would have considered a literal miracle. The absence of pain, the gift we don't think about, the revolution that changed everything.